Well, it is Kareem again, and I have a special guest, which you've already heard from. But she's also a friend to the room, the platform, the dance floor, however you want to call it. Welcome back, Anne-Marie Noraki. Anne-Marie, how are you?
Hmm. I it's Friday, so I am doing all right. How are you?
Yeah, I'm in the same boat as you, girl. I'm letting my hair down. It is Friday.
Dude, I'm blind, so I can't see if you got long hair or not. So I'm gonna trust you on that one.
Well, fun fact is, I used to sport very long hair, and my hair was about a little bit past shoulder width, and not dreadlocks, braided. And when I let it out, yeah, it was down to the shoulders. I sported that for I want to say maybe about 19, maybe 20 years, and then I cut it and donated it to my mom when she was going through her cancer bout.
Oh wow,
Yeah.
that's cool.
So the person that people know now, they would never guess that I had such long locks, so to speak.
Mhm.
Oh man. So ladies and gents, today I know we've been hitting you hard with a lot of transverse myelitis and neuromyelitis and MO topics, which is pretty sound in this community, but also on this stage, lupus is a very prevalent thing. Because myself, I am actually diagnosed with lupus. And Marie, you are also diagnosed with lupus as well.
Unfortunately.
Yeah, unfortunately. So ladies and gents, we're gonna cover some lupus things today, mainly stories, of course. We're not gonna get medically sound in that. But yeah, listen to the stories, some of the 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 protocols you can possibly do for yourself if you haven't been doing that stuff already, as far as self-care and staying up to date with medications, and definitely hoping that you are checking in with your care team on a regular basis, however regular that is for you. Okay, so let's start it off with this, Emery.
Mhm.
Your diagnosis, which type of lupus were you diagnosed with, and how was that journey for you moving forward?
So I I have SLE, so the systemic lupus um, erythematosus, and that joined my autoimmune body party, I guess if you want to put it that way. Um, back in 2022. Um, because prior to that, I had already had like the neuromyelitis optica spectrum disorder
Mhm.
for at least 20 years at that point. So
Mm,
it was like, oh, well, I didn't really expect, you know, this, although I always kind of had it in the back of my head that there are always these dual diagnoses that occur.
mhm.
Just didn't know when, if and when they would show up. And, right after I got done with my master's program is when this one popped up. So, surprise.
Yeah, I was diagnosed with SLE as well. And that what for me, that was at the beginning stages of quarantine during COVID.
Hmm.
And I usually chalk it up to having like emotional stress that happened, because prior to that, myself and the family, we were experiencing the death of my mom just a few months prior in 2019. Uh, so I always usually say I never really got a chance to process fully everything about the death. Because to be
Right.
quite honest, that was my first time around the block with that one, especially, losing a very, very close family member like that. Um, and as we were going through that, it was kind of like, bang, here comes COVID quarantine, and you never really get a chance to think about, what you're dealing with someone passing. Now you're thinking about, okay, well, the entire world or most of the world isn't working anymore. How am I going to live from day to day? Because unfortunately, bills never stop coming. So you got to figure out how to pay that stuff and, keep moving on with your life. Um, Moving forward, I
Yeah.
remember I was working out one afternoon and I don't know, my back, it just started like my back muscles just never wanted to relax and it just become just unbearably tight. So I just decided, okay, let me just go give this a check out. Let me let my doctors know what was going on. Fast forward a little bit because I don't want to keep this because this is a very long story. But yeah, it's got a episode for itself. Um, but my doctor, she says, Kareem, your muscles, they should not ever feel this tense. And literally, she said, I want to, test you for an autoimmune condition.
Mm.
I mean, I didn't know what to think about it, but I'm not ignorant either. So I said, all right, whatever, and for the sake of health, let's do it. And lo and behold, they run the test, they tell me this, they tell me that, they show me this, and it's like, yeah, you tested positive for lupus. It's like, whoa, okay. So that we sat down, I was talking to her about it, like how could it actually, be a thing? And of course, me being Curious George, I did my own research as well. And it's not a common trait in my family, but with the amount of stress that I was going through, you know, during the passing of mom, that seemed to open the gateway to that particular avenue.
Mm.
So that was pretty interesting. Pretty interesting. But thankfully everything's been pretty stable. I've done biopsies on my kidneys and things like that. So things pretty much checked out. Thank goodness, knock on wood, and everything else good in the universe.
I'm
Did
noticing a scary common ass theme though, with kind of like the onsets of both of ours, the
hmm
the stress part, because you were dealing with the stress of your mom,
hmm
and I was dealing with the stress of my master's program.
hmm
I don't know, could be a correlation, could not be a correlation. I may be putting too much into it, but we all know that stress makes autoimmune diseases flare, so
Yeah.
could have been the igniting spark that brought it on.
And it's kind of crazy though, because at the time you're dealing with things, you may or may not even know that you're dealing with a certain kind of stress or trigger. Because you're
Mhm.
just, you're doing what you would usually do to subdue whatever is like that nagging feeling. So for me, I would usually just go work out. So I'm not thinking anything stressful there. Like you go work it off and do as you need to do, but you never really know how much is still like lingering on the inside, you know,
Yeah.
until what's that old cliche saying is your body keeps the score. And you're like, what kind of score? Like, I don't even know how to identify with what that score is until something like this happens. And, you do well, for me anyway, you do your regular self checks and you go back and you go, oh, maybe that could have been a thing. I don't know if you ever look at it that way, but that's what I usually do. Self check it and see what could have been like a variable.
Mhm. Well, in your case, at least that doctor had enough sense to not just check out your muscles and say, hey, you should go get a massage.
Right? Seriously.
Or go do some yoga or something, I mean, don't get me wrong, I'm a massage therapist. I'll support the profession and all that, but
Mm.
she kind of had enough. brains to identify when there was an actual issue underlying the presentation there. So good job, Doc. Like,
No, she was awesome for sure. She was for sure, for sure. But when you got diagnosed with it, like what was going through your head? Like, so you already had NMO for upwards of that 20 years, you said, right?
oh yeah, it was 20 years. Hmm.
And then you're open, the window's open for lupus. Now, what is going through your head? Like, what are your thought processes at that point?
Well, honestly, that the funny part was that as I was finishing up like my master's program and I was doing all my papers and all that crap, um, that's when I started getting like the joint pains in my wrists. And I was just thinking, oh, for the love of God, I was like, great, I'm getting carpal tunnel syndrome. And, I went and I got braces, little hand sleeves for working on the computer and all that, and saw some specialists for like the orthopedic hand doctors who specialize in like carpal tunnel syndrome. And they ran all the tests. They did like the EMGs and all that fun stuff. And he was going to do an exploratory surgery because all the tests were kind of inconclusive for carpal tunnel. And then I started to get pains in, joint pains in my hips and my shoulders. And gee, let me think. Your carpal bones and carpal tunnel syndrome doesn't go anywhere outside of your carpal bones in your wrist. So, having obvious knowledge of like the body and healthcare systems and different diseases from when I went to nursing school and all of that, I was like, I I called up my doctor, my neurologist, and I said, "Hey, in that CBC that we're going to be doing soon, can you run a lupus panel?" And I told him what was going on, and I said, "I think I might have lupus." And so he added the lupus panel on, and to this day, my rheumatologist still laughs. She's like, "You are the only patient I have ever had that was self-diagnosed." It was like, I don't know. I just common sense, you put two and two together with, having body aches that kind of spread all over from what the initial presentation is, and, just knowing that's spreading.
And that was the only initial flare that you ever felt? Have you ever felt like ill or weak or anything like that?
Knock
Like
on wood.
extreme weakness, I want to say.
No.
No, okay.
I mean, yeah, I've had like my joints and my hands have been, red and puffy and swollen, which, medication, knock on wood, has kept all that in check.
Hmm.
And yeah, now I have good old arthritis in my back at the age of 40. Woohoo!
Oh man.
It's it's like let's just add on to it. And now that I disclosed that. But yeah, you start adding all of it up and it's just kind of meandering with the disease and kind of, I believe you kind of touched on it before with kind of you move with the disease and kind of adjust with it.
Yeah. 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 It's kind of crazy how like inflammation can just get anywhere, you know?
Hmm.
Just wish like there was like a magic tonic water where you could just drink and just flush your body out and just be like, all right, I'm good as new. Let's keep life going.
Have you ever tried one of those? to do like a body cleanse or anything?
Um, I can't say that I have to say I've done a body cleanse. I've done like a detoxification. Um, I don't even want to call it a cleanse, but I
Yeah, well,
just
like that. Yeah.
yeah, I've done that. Did I feel any better or different? I don't know, but what I would say, and thank goodness my labs were never like off the scale, but it definitely kept a lot of things in check, or if anything was down, it definitely got to where normalcy was supposed to be on the lab scale. So
Mhm.
those detoxes, they definitely do help because I mean, a lot of these things, always come back to having really good gut health or really bad gut health. And, what you put in determines what's going on the inside. Um, so I want to say that definitely did help. And currently I still do them, got like these herbal drops that I've used. Um, my diet's never really been a bad diet. So, I'm not fearful there. It's just, yeah, just being very strict, a little stricter with consumption.
Yeah, I was wondering because I heard about detoxes and I wasn't sure if they were, successful and if you tried it and how it went.
Yeah. I mean, I can send you a list of some of the stuff that I was using. And a lot of, and I drink a lot of tea, so um I guess that has a place in it. I don't know what percentage, but they definitely do help. Like some of these herbal teas help the soothe the nervous system and, you
Mhm.
know, decrease inflammation and things like that. I believe they do help. Um, but then again, maybe I'm biased. I like tea, so I'm gonna drink tea all day if I could. Um, just like I love apples. I'll eat apples all day and won't miss it at all. Like, yeah, it's just that for me. But yeah, I think it has its place. Definitely do. And it's a healthy choice. So
Mhm.
you can't miss that. Definitely can't.
Yeah. I'll, I'll,
Yeah.
I'll, I'll I'll hunker down and actually try it eventually. But I guess I think I mentioned before, yeah, Dr. Dora and I, we're working on that diet part. So it's a work, it's a work in progress. It's, that's all I like to say. Work in progress.
I've got to reach back out to her. She's such a great person.
Hmm.
Oh my gosh. Have you ever had any other like invisible symptoms other than the ones that you had before? Like any new ones? Or everything's been pretty much uniform?
Um, and I know I can use this language about with you. So, the number one pain in the ass is the fatigue.
Hmm.
It's just, um, it's draining.
Yeah.
And sometimes I find it super hard to get just like basic tasks done. It's, the mind is willing and I have so much I want to get done,
Right.
but then the body just it doesn't
Just
want to
shot.
it doesn't want to cooperate.
Right. Right.
And I mean, I have and it's not my first cousin. It's so my mom's cousin has lupus.
Hmm.
And, that's how she is too. She says it's the energy. So she kind of experiences the same thing. She has the body aches, the energy.
Yeah. I mean, it was funny. I've never really dealt with like any of that.
Really.
No, I really haven't. I just knew it was a thing that I was going to be dealing with, but like brain fog, I mean, no. I mean, every now and then you'll be talking and all of a sudden, you may forget a word that you were trying to remember, but no, no fatigue, no brain fog. Thank goodness no body aches or anything like that. Um, I don't know, so maybe call me lucky, I suppose, but and if I did, I really wouldn't even know how to identify with it, because I'm always like here, there, and everywhere and pretty much upbeat,
Mhm.
So I don't know. I don't know if there's anyone else who's ever felt that way, or although they've been living with lupus. I don't know. But that's a question I always get from my kidney doctor. How do you feel? Like this, that, tired? You like, no, still the same person. Nothing's changed.
Or you can use the snarky answer like me and my grandfather would use, be like with my fingertips. Yeah, just to be cheesy and smart alecky. It's like, how do you feel? Oh, with my fingers. Um, but, and then you get the eye roll, and it's like, well, yeah, you asked me a stupid question because you know you're going to get a stupid answer. Um, because the answer is usually like, well, obviously not good. You really want the like detailed.
Right.
You want me to spark notes it for you. Okay. For those of you under the age of, I don't know, 30, Spark Notes was like something that we used to use in like college. And it would help like shorten things and abbreviate everything that you would have to read, and it would make things a heck of a lot easier.
Yeah,
You probably remember it.
I did.
Yep.
Oh boy, we've come a long way, didn't we?
It's like there was no chat GPT to do the answers like that. So
None of it. None of it. We actually had to do the research, people. We had to. So how
that's
do you
when
manage your flares? Or well, before you even manage your flares, how often, if at all often, do you get flares? Or is it like far in between?
I hmm I can't even, aside from my initial flare, I don't think I've really had any
Mhm.
since we've gotten to the proper dosage with my medications. Um, One wasn't enough, so she had to add on a second one. Um,
What are you taking?
yeah, I was getting there. I was getting there. Hold your horses. Um,
I'm excited.
Sheesh. So we started out with the Plaquenil or the hydroxychloroquine,
Hmm.
and then that wasn't totally cutting it, so my doctor added on the azathioprine or Imuran. So so I'm on both of those now.
Hmm.
And like I said, knock on wood, it's been 4 years and no flares. How about you?
No. And that's another hard question for me because I really don't know how to identify from day one when we found out this was a thing and they're prescribing the medication to keep inflammation down and such. I looked at the symptoms and I tried to correlate it with me in life, and I'm like, I've never dealt with any of these things,
Mm,
so yeah, I really don't know. Um, I even try to look for what might be a trigger. I really don't have an answer for it. So I sat down with Dr. Moses, who is my kidney doctor, And I asked him like, what should I be looking for? Because I am blind to what these triggers and these flares are. So he's like, look, man, you're doing great. Don't look for anything that isn't there. Just know if you feel out of place for what you would usually feel, unless it's like the common cold or something that you would, usually pick up on site, right?
Hmm.
Um, you know, try to note that and see how long it takes to subside or go away. And if it's just kind of riding for a long period, that just might be a flare or that or a flare or that trigger that you know you can now identify with. Um, but thankfully, again, like no, no weakness, none of the symptoms of literature. No, none of them, none of them.
Wow.
Yeah. So although we're dealing with this thing, there's still some harmony in my body. Thank goodness.
Yeah. Now you're being managed by, you're saying by your nephrologist?
Hmm.
Okay, because mine is being managed by a rheumatologist.
Well, both of them because they work both closely together. So my rheumatologist is Dr. Aaron Patton, and my nephrologist is Dr. Andrew Moses.
I don't even
And
have a
so,
nephrologist. It's like, maybe I should get one on board. I have so many other ologists. I should probably just add another one on somewhere.
it's crazy. So uh, now that I was dealing with all these autoimmune conditions, then I found out like there's so many ologists for so many other different things. I'm just like, how many of these people can exist? And there's a job for everyone.
Mhm.
That was crazy to me. It's a thisologist and this, and they take care of this. So you mean you just decided you were just going to focus on just kidney work or this and this and this and this? It was extreme to me. Really, really extreme.
Hmm. Yeah. Okay. I was kind of amazed because before I was having kind of dizziness and all of that, and they sent me to an otoneurologist. I was like, well, that's different.
I
But
was just gonna say that.
it's like I didn't know that was a thing either. So,
Mhm.
yep,
Oh my gosh. So how do you manage it? Do you just kind of like kick back, sleep it off?
pretty much. Yeah. I mean, it's what you do because it's kind of like I don't know. I guess the way I could kind of like, and this is going to be a horrible analogy, but I'm sure you'll understand it. But it's like buying a pair of shoes. And it's like when you first get them, they might be kind of uncomfortable. And then you'd kind of break them in and then you kind of get used to them. They're just like that worn in pair of shoes. And then you're just used to them.
Yeah, I get that. I
It's
get
like,
it.
so in the beginning, it's just uncomfortable as hell. And you're just kind of like going through the motions with it, just trying to get used to it. And then you're like, okay, oh, well, I'm used to this now. Okay, I guess I, you get along daily life, you're comfortable with it. And then you just kind of vibe and you're used to life with it.
Yeah. Yeah, you're pretty much your adjustments.
Hmm.
Yeah. Wow. I get that for sure. It's like as long as everything stays uniformly familiar and you don't have that one thing where you're going, okay, this is different. What is it? You know, you can deal with that. Give me the familiar rather than the unfamiliar, I suppose.
Oh, like throwing COVID into the mix or some other sort of outbreak or
Jeez Louise. Wait, so let's pivot a little bit. So you say COVID. I was working with a patient of mine the other day, and she was telling me about this new virus that was on this cruise ship.
Mhm.
Forget the country that they were in. And she was like, yeah, every single person on that cruise ship contracted the virus. And whatever the docking stations they were supposed to dock to, that country is no longer, was not allowing anybody, nor the ship, to get close to shore whatsoever. So I was like, you mean these people are just stuck out there like a bunch of sea-driven zombies? Like, what is supposed to happen here? But yeah,
that,
so the last thing we need is another virus outbreak.
yeah, well, we do have some of them back. So some of the people are back in quarantine. Some of them are here in the US, the patients that were on the ship. I know they were in they docked in the Canary Islands to
Hmm.
let the people out. Yes,
Oh my
the
God.
that wonderful, I think it's a Hamta virus. That's what you get from being around rodent feces.
Jesus.
Mm-hmm.
Yeah. It's one of those things. I
Yeah.
never had hamsters. I don't know how people have pet rats. I'm like, nah,
Mm,
no.
No, this is being around like probably like rats. Like, dude, you're in New York. You get it.
Yeah.
I was like, I don't have to say anymore. Like, I get it.
Uh, I see those things and I go the opposite direction. I kid you not.
Mm-hmm.
I was going to a doctor's appointment last summer, and this is early. So my doctor's appointment had to be about 6:30. And from there, I was just going to head to work. And I'm walking down the block, and the sun is just coming up, but the street is somewhat dark. It's kind of like purple. And I see like three rats just run across the street. Emery, when I tell you, I turned around to go around the block to come up in the other direction. That's exactly what I did. There was no way in hell. I was like, screw this, man. I'm not dealing with rats this early in the morning.
Mm-mm.
Not that early.
Nope. I don't blame you. I totally don't blame you. So yeah, that was kind of their whole that's the where this so outbreak kind of came from the cruise ship when they I think they said they were bird watching. So crazy.
It is. It really is. So how do you manage well, in the early stages of it with the lupus, how'd you manage that with work? Did it hinder you at all?
Mm. Well, thankfully, kind of in the early stages, I was still waiting for my uh I was still waiting for my licensure as a social worker to go through because you have a period after you apply with the state to get all of that fun stuff and wait for the licenses to get approved. So I was kind of in limbo waiting for all of that. So I had a good 6 months or so after the onset for me and the docs to kind of test drive different doses and medications and all of that till we kind of found our little sweet spot. So it didn't really impact too much. Too much was me in that regard at that point. How about you?
No, it really didn't. I just knew that that was a thing. I made it my mission to not really think about what the flare-ups could be. Um, because I just didn't really want to, I didn't want to look for them. I
Hmm.
just knew if I felt something funky coming on, I would just either, pull myself to the side, gather myself, and, do the regular self-check. But for me, I was just firing off on all cylinders. It's like, all right, this is here. It's not going to kill me tomorrow. Keep living your life and keep doing what you're going to do. Yeah, that was my whole mindset with this. I just wanted to know what are we going to do about it, how
Hmm.
we're going to approach it, and just keep moving. Did you have to do a biopsy on your kidneys?
I did not. Not yet.
Okay.
I'm
I
going to
was
say
one of the,
injured yet.
yeah, that was one of the first things I did. And thankfully again, everything checked out the way it should. Um, but that was different. Um, Now I was talking to my doctor today, same doctor, Dr. Moses, and he had another nurse in the room, and he's like, "Let me tell you about this guy. You see how built he is, right?" She's like, he says, when I was doing his kidney biopsy, that's when I realized how thick his back muscles were. So he could not really get the needle in to my kidney because my back muscles were so thick. He had to do something else as far as the procedure to actually get in there. And he
Hmm.
says when he's doing it, he can hear the muscle fibers in my back just kind of like almost ripping away. And it was like the funniest thing in the world because I was laying there and I was partially asleep. I was just fully relaxed. And I was like, who's ripping paper? So he was trying not to laugh, but after, we were all done, he was like, no, that was your back muscles, man. Like it was hard for me to get past them to actually get to your kidneys. But yeah, my stories with lupus is completely different. Completely different. It's
So it
either
wasn't,
humorous and educational at the same time.
so it wasn't like a needle biopsy then.
No, it was something else or the other. It escapes me right now, but it was easy though. It was very, very easy. Um, the preparatory parts for it, it was more extreme because I looked at everything. I was like, we really got to go through all of this? Yeah, all
Hmm.
right, whatever. And yeah, pretty relaxed if you ask me.
Aside from
I don't know
ripping
how it
paper.
is for everyone else. Yeah, right. Seriously, that was crazy. That was crazy. Who knew muscle fibers were that I don't want to say dense, but yeah, it was just bizarre. It was a bizarre thing.
Well, you probably never. Did you ever take anatomy in school?
Yeah.
Did you ever do the cadavers?
No, I never got a
Oh,
chance to do those. No.
never mind then. I was gonna say, if you went to that part, then yeah, you'd seen it. You'd see how like thick and like the tissues and
Well, what did you have to cut?
hmm?
What did you have to cut from? Did you do it from a animal itself or
Um, well, I saw the human one and then I did the animals too.
yeah, I never got
Like
the human one.
yeah, the human one was kind of like pulled back the neck, the different layers of like the neck muscle and like the sternocleidomastoid and all those up in here with the upper traps, and it was just kind of like, ugh.
Hmm. Ugh.
Yeah, it was different to kind of see how like beef jerky esque it was. But
I bet you looked at beef jerky very differently after that, huh?
oh, yeah. you I never looked at it this same way ever again. So
Oh my God.
yeah, but yeah, the body is a very interesting thing. Um,
So you have lupus
mm,
and you've had the NMO prior to that.
mm.
So once you found out that you're going to have, let's say, a cousin to what you already have, like where did that put you mentally? Like you go, I've already got this devastating thing going on. You're going to add something else onto it. Where did that put you in your mindset? Like, what are you thinking at this point?
I was honestly along the lines of, great, here we go again.
Mm,
It was just the frustration of it, you know.
yeah,
No, I'm like, great, now we get the because, you know, you've experienced it to where you gotta test drive the medications, try out which ones work, find out what dosage, see how you react and all that fun stuff. And then you see how, you know, how you tolerate it with your other medications and then play like the balancing game. But thankfully it doesn't sound like you're on a lot of other medicines.
no, thank goodness. Yeah, no, I chalk it up to the universe and healthy living and a lot of activity, sports wise, or just being an athlete. It definitely built a somewhat of a bulletproof in my body to allow me to still be wholesome enough, if that's the word I want to use, to not be on this medication, because I've seen some of my patients, man. I'm like, that is 20 pills you've got to take every day, So I want to give grace to my lifestyle. I think that definitely helped me a lot dealing with both these things that we've got going on.
Dude, I'm trying to do the math. I don't know. This is my old lady pill container. So I couldn't even tell you. I take like see, 8 in the morning, 5 at lunchtime, 3 at dinner, and 4 at bedtime.
Have you ever missed a dose or forgotten to take one at a certain time?
Yeah, I just push it back later on.
Oh, so you don't feel like, like your body's going into like,
Mm-mm.
okay,
No, I'll just take it when I remember it. Take it later on.
all right.
Mm,
Uh, Wow. I remember, and I only asked because I remember I was working with one lady. She completely different thing she's dealing with. She's dealing with Parkinson's disease.
yeah.
Sweetest lady in the world. This particular day, um, she wanted to write something and she couldn't find a pen. And you can't find a pen. You're just like, all right, whatever. Can somebody loan me a pen? It's not a big deal, right? That day for her, she became the exorcist.
Mm,
There was nothing available for her to write with. And this lady went off the hinges. Looking at her, you would never guess she would use some of the words that were coming out of her mouth and acting as irate as she was. Listen, she is the little lady. She's a little old lady on the grandma cookies packages. That's who she is. And she went off the hinges. But then when she realized like what she was doing, she said, Kareem, I'm so sorry. Like I forgot to take my medication today. And when she showed me the pill box, Anne Marie, it might as well be Halloween because it was nothing but colorful pills here, 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 here.
Uh-huh.
I don't know how many pills are in there. It was just too many to count. And I'm like, this is just too much for one person for how many times you got to take this. So, yeah, I feel like that whole chemical imbalance, like once it's not there, it does something. So that's what made me ask, like, does it ever make you feel a certain way? Because this lady went from the sweetest old lady to like revengeful Hulk. She changed,
Mm,
definitely changed. So that was a big surprise to me.
yeah. That's why I have to guess we have to keep hoping that lupus preserves our liver and doesn't really attack that because that's kind of our that helps filter everything for us.
Mm. Yep,
So,
yep, yeah, it's nuts. It is nuts. And also, folks, make sure you drink plenty of water. Stay hydrated
mm,
because a lot of these medications, you may not feel it, but you do get dehydrated from a lot of this stuff. So definitely stay hydrated. Um,
I don't even follow that advice, and I'm supposed to keep working on it. So,
um, misconceptions. Like,
mm,
so I'm sure like your family, they all know about your lupus condition.
mm,
What is the biggest misconception, if any, that they may think about your condition?
sure. Hmm. I honestly don't know. Like I said, because since we kind of already had lupus in the family, I guess maybe that's why it was kind of a little more understood for us.
Right.
I guess the only thing that I guess is still kind of difficult for them to understand is, my level of fatigue that I kind of alluded to earlier. It's just that,
Right.
you know, not having the oomph to do what I want to do or have to do.
Yeah. Have you ever had to advocate hard for yourself with a care team, or like that was pretty smooth as opposed to like the one doctor who told you about the too tight bra syndrome?
Oh, that was an idiot. That was an ER doctor that never would ever be allowed in my room. Um, no, no, thankfully advocating for myself with the lupus has been smooth as butter because
Mm,
like I said, pretty much diagnosing like myself and just having the very easy conversations with my both my neurologist and my rheumatologist about it all.
mm, mhm.
With, how are your symptoms going? Oh, how are you doing on both medications for NMO and lupus? Okay, you're doing good. No relapses of either one. Okay, great. See you in 3 months.
Right.
It's getting that, I don't know, that stamp of approval and being able to breathe that sigh of relief, which kind of gives you the, I guess the reassurance that you're advocating for yourself properly and doing the right things. in a
Right.
in a in a weird way. So
Oh, you know what I was going to ask too? I'm sorry. Go ahead.
I
You
was
can
gonna say
finish
in a
up.
weird way, even though my diet sucks. But yeah,
Okay, wait. Two questions. You said that. What is your diet like?
we're not gonna talk about that. I just ate a beef enchilada with some rice for lunch. So I guess it wasn't horrible, horrible. But like breakfast was toast and coffee. Don't know what dinner's gonna be. I should be planning it out, but I'm not.
Whatever you do, stay away from the cookies.
You don't owe me. And yeah, I have that sweet spot, and when I do have a cookie, it's usually only like one or two. So I've never, even when I was little, I never sat down and gorged myself on sweets.
Right.
It's just like,
It's
oh, I
just
have it.
enough.
Yeah, it's like I have a, even my grandpa was the same way. He's like, oh, I have, you drive my grandmother crazy. He said, oh, I have a taste for a beer.
A taste okay.
So then she'd go out and she would buy, she'd buy all these, like a 6 pack of beer or whatever. He'd crack one open and he'd have a sip. And then she's like, you're not drinking the rest of it. He said, well, I said I had a taste for it.
Put the rest in the refrigerator.
Yeah. So then you know, he would just let the rest of it kind of, rest of it, oh, no. You just kind of have a
Well,
taste
that's
for
cool.
something. It's not like you're gonna go crazy.
Right, right.
And I'm the same way with
And the
sweets.
other thing was, how do you manage sunlight? Like in especially spring, summertime. We're all going to be outdoors for the most part. Like, do you have a time frame where you prefer to be outside rather than inside? Because I know for me, my rheumatologist said try to be out of the sun between 11 and 4. Try,
Huh.
you know, because she knows me. I'm very outdoorsy. And she said, if you're going to be out there, wear long sleeves. I'm like, this is New York City. Long sleeves in the summertime, that ain't going to work. Uh, but yeah, I try my best. Try to navigate a lot through the shade. Um, because there's no way I'm really staying inside during the summertime. That's just not going to be a thing. But I think I've been doing pretty good. My skin is not scarred or anything like that from some of the skin, let's call
Mhm.
it skin lesions
Right.
that could possibly happen, being exposed to the sun for very long. Um, yeah, how do you navigate that? Are you like as outdoorsy or do you just kind of like do as you need to?
I, hmm. So I have a love-hate relationship with the outdoors. So I love being outdoors. Um, but I my balance is so crappy.
Hmm.
It's like walking on the grass and stuff is I'm super unsteady. So I know you had mentioned in one of the other, and I think in one of the meetings with, I think in the Mental Health Monday or like HCP that you're like, oh, people that ride their bikes are like, you see them, you're like, oh, show offs.
Yeah,
And
yeah.
like, yeah, people that can walk on grass without having to like pray that they don't fall over, show offs. Um, but yeah, it's going outside is I- I'm an August baby, so it's like I love the outdoors.
Right.
I'm working toward my sailing license, my
Mm,
adaptive sailing license, and just, outside with the fresh air is like my happy place. If
awesome.
if my balance wasn't so damn crappy. Um, and I could go outside on like, you know, hikes and stuff in the woods and stuff like that. I'd probably be a lot happier, but
Mm,
c'est la vie.
yeah, yeah.
Mhm. So in the meantime, I just manage it with baseball hats, trying to kind of cover up the face and just sunblock if I can.
Yeah. Do you ever wear one of those big round hats, like the sun hats? Is that what they call it? The sun hats? Just to give you
Mhm.
extra, like, face protection, maybe some shoulder and neck protection as well.
No, I look pretty doofy in hats anyway to begin with.
Hmm.
So I'm sure I would look even sillier in one of those. Um, just just me with like a baseball hat's even kind of funny. So I can only imagine what like one of those straw hats or like sun hats would look like. But they look very like nice and summery and lightweight.
Yeah. I mean, I've never worn one, but I've seen like during the summertime, like when you're out and about here early in the days, like around lunchtime, you see a lot of people, well, a lot of ladies wearing them. They look pretty cool though. Um, how they actually stay on, I don't know if they're fitted to your head, but depending on what you're wearing, it fits. It definitely does.
Oh, well, you're up in New York. Of course, you're going to have all the fancy dressing people do.
Yeah, it's so fashionable over here.
Hmm.
Oh my gosh. Uh, so I don't even know how I don't even know how to answer this question for myself, but how has this changed like your outlook on life, um, dealing with this lupus? I mean, yeah, we both are dealing with two autoimmune conditions, but with like the lupus, like how did that change your outlook?
Um, well, I think for for me, lupus just kind of, I think I just started mentally bracing myself. So I'm still going about life as usual, normal. I don't really let it bring me down, but I'm always kind of anticipating that somewhere down the road, some part, whether it be joints or something is going to get worse. And I'm just assuming, just judging by my history, that that's going to be the part that's going to go. And just, I think preemptively anticipating that gives me anxiety. And, so that's when I always joke around about this with my neurologist. I was like, dude, the NMO, having it for so long and knowing how to manage it, uh, the NMO, even though it's rare as hell, I can manage that. I'm used to it. I was like, the lupus one. I said, the lupus is the one that's like, you know, 4 years in, I'm still kind of getting used to the dance and kind of squaring myself away and finding my just finding my footing as I'm going forward.
Right.
I'm sure I mean, you got diagnosed during COVID, so you kind of know.
Yeah. Yeah. I mean, even though they told me that, I didn't take it like it was a hard swing, you
Right.
know. I just kind of took it and go. And I said, "Hey, you know, so what are we doing about it?" And that was really my attitude. Like, what are we doing about it? It's here. What are we gonna do? You know? And that's the way I pretty much step to everything. Like, I don't dwell on problems. Like, if the problem's there, we know what it is. What's the solution? You know? Well, let's do that rather than, tiptoe in shallow water and not be able to do anything. So, I mean, that was pretty much my outlook on it, I suppose. Um, I mean, that's also subject to change at some point, but that's really who I am, you know. That's really who I am. I'm not gonna sit in the problem. Get it fixed, you know.
Well, you probably get everything. You probably have all of your routine blood work and everything to monitor all your numbers and make sure everything's hunky dory and all in check to see if you're trending in the right direction and all that with lupus as well. So
Yeah,
you know whether or not you should be making any positive changes in one direction or the other.
right. No, absolutely. You're right. 100%. Yeah. Um, yeah, and and those numbers, they don't lie. So it's either they change or they stay pretty much uniformly the same. So you're either looking for the uniformly the same or somewhat better. If anything goes below that, then we got to go, okay, we got recheck something here.
Hmm.
But for the most part, everything's been pretty much, status quo. I can't complain. You know, keep trekking on is what I say. Trekking on. So here's the that question. Um, so hypothetically, you just meet someone new or on accident. You're sitting in the park, and they usually say if you're going to speak to someone, speak to a stranger because you're probably going to get honest feedback from them, if they're going to give you feedback, and it's probably not going to trek to anyone you know. And the stranger is talking to you, and they just said, "I got diagnosed with lupus," whichever form of lupus they're dealing with. Probably not the neonatal because that's for infants, right? Um, or no, we can keep that in the example. Doesn't have to be them. It
Babies
can
don't
be
talk.
right, but but this is the parent talking to you. Um, and they're telling you how they feel, and they're not the happiest. What do you say to someone newly diagnosed with lupus, or they know of someone newly diagnosed with lupus? Hence, let's say the newborn baby, and they just don't know where to put emotions, don't know where to put their headspace. They're filled with so much everything going on inside of them. What do you say to someone with a newly diagnosis or someone that they know that's newly diagnosed?
Do you want my therapist hat or the actual like advocate hat?
Put both of them on.
Okay. Uh, my initial instinct is to let them know that they are not alone and connect them because they can go online and even like a quick Google search will pull up, support groups and resources like the Lupus Foundation and all these different things and resources to where they could find, you know, like I said, support groups and other ways to connect with people who are like them and going through the same, you know, maybe they may not be in the same exact diagnostic stage. They may be further along, but they've all been in that same spot at one point.
Mhm.
And it might help give them some sort of comfort to see that other people are being successful and they're managing life and that it's not this gloom and doom, dire diagnosis, and that you can kick it.
Good. Well said.
I'm a
Now,
glass half full person, obviously. So,
was that the therapist hat?
no, that's just me. That's both of me hats.
Okay.
Hmm. Yeah, that's both.
I think I wanted to hear the individual. I want to hear the one side versus the other side.
I don't know. That's a mishmash. That's both. Yeah, because it's so intertwined. It's like being a advocate for both like myself and the disease has only played into my role as helping others as a therapist.
Mhm.
So that's what drove me to do it, you know. So,
No, 100% agree.
mhm.
100%. That's kind of like the way I feel about, starting up this podcast thing. Although I'm still green, going about it, and it's a work in progress. But the fact that I can sit here and talk to you and talk to Nicole, Dr. Dora, a few other people, Miranda, who was just recently on it,
Mhm.
and just by talking to you guys, putting it out there and being able to communicate with everyone else, like Miranda, who's in Hawaii. Go figure, you know.
Oh, let's not talk about that Lanai view.
But to connect with so many people from who's far and wide, it's an
Yeah.
awesome thing, So just bringing that awareness about is a beautiful thing, I think,
Hmm.
So and it's also a way, I believe, for us individually to just keep growing as people or as a person and to be able to loan yourself in a different way than most people would usually know you for. Right. So still being in the service of people in a different manner because there's so many people around who needs, some, what I want to say, who needs a different interpretation, or just maybe need to hear it from somebody different as opposed to the folks who are already close to them. Because sometimes that's not, I hate using the word best, but not the best solution
Hmm.
or answers you need at times. And no fault to them. It's just sometimes they just don't know how to carry it over, right? Uh, but I think that's the beauty about this. Just being able to loan your voice, loan your experiences, and have people communicate with that and bridge their own gaps with it. I hope that makes sense to the public. But yeah, I think we're doing the right thing, Anne Marie. I think so.
Yeah. In our own quirky ways, I believe we are.
Yeah. Yeah. Quirky. I like it.
Hmm.
We need that. We need a lot more of that, you know. The world needs a lot more of that, some quirkiness rather than all the crazy stuff that's going on.
Amen to
Insane.
that.
Right. More laughter. More laughter. Emery,
Yeah.
again, this was pretty special. I'm glad you were able to come aboard again and have us discuss something different other than the NMO, but still keep it pretty much versed in our our still community. You know, um, ladies and gents, this is not just a platform for NMO or lupus. This is going to encompass everything autoimmune, even the ones that's far from myself. Um, it's a learning curve. So as much notoriety as I get from this and the things that, you hear but you don't know about, take it as good education. You're learning something new about something that you've heard but never witnessed. So this is what this platform is for. So Emery, thank you again for your generosity in allowing us to pick your brain and sharing your stories and giving us your quirky wittiness.
And banter. Yeah. 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 All that.
Everything under the sun.
Right.
you know Love having you on this. So at any point in time you feel like, hey, you want to ring that doorbell again, by all means you do so. um
Oh, yeah. I got your email. And you
oh,
know
you
where to
did
find
get
me.
and if you think anybody else can benefit from this, by all means share the platform, the information is absolutely fine. No restrictions on that. And ladies and gents, so concludes episode 6. May is Lupus Awareness Month. So thank you for tuning in. And at the grace of the universe, hope we'll see you same time, same channel, same place. Be kind to yourselves and one another. And we will
Oh,
see you again shortly. Go for it.
don't forget, May is also Mental Health Awareness Month, so be
Thank you
kind to
for
your
that.
brain.
Say that one more time.
I said, be kind to your brain.
Yes. Yes. And thank you for recapping on that. It did totally slip my mind. Um
Hmm.
so yeah, ladies and gents, definitely do your self checks. Okay, definitely do your self checks, and if you can't do it on your own, reach out to your credible sources. Okay. Um and I think that is that. How do we do, Anne Marie?
Bueno.
Bueno, bueno. Grazie, grazie. All right, ladies and gents, we'll see you soon. Be well.
Okay.
Uh,